So I am, like he mentioned, a clinical psychologist here at National Jewish. And my background is in helping people with chronic illness, including NTM and other pulmonary issues. These days, I'm more in the sleep medicine world, so I do a lot of work with insomnia. So I'm going to talk about that today because I can't help myself. And there is some overlap with chronic illness as well. But my goal is really to give you a tool set today. So if you look in your folder, your little brochures here, all of my slides are available, and there's way more than I'll be able to go through today, but I wanted you to be able to take that with you. So I'll spend a little bit of time talking about stress and NTM, although I probably don't need to tell anyone that NTM can be stressful. I'll talk a bit about building a coping skill set, social support, which is very important, and then also how to receive professional support if you should choose or if you want that. So when it comes to stress, with various health conditions, including NTM, first of all, can everyone hear me okay with this microphone? I didn't even check it. Okay, good. It's stressful to adjust to, a new lifestyle, to adjust to anything that's different from maybe what you were experiencing before. There's often fears about future health. A big one is balancing family worries. So family is sometimes more concerned than you are, and sometimes that can even be a bigger burden for people, is also helping family members deal with illness. And then, of course, there's depression, anxiety, anger, frustration. I'll talk a bit about what depression and anxiety means in a clinical sense. But these are also normal emotions that can happen when you're grieving, and people grieve with chronic health conditions. So managing stress can improve the quality of your life. It can help you manage your condition long-term. It can also improve your mental and physical health. I think a lot of times people forget that our head is connected to our body. So what impacts one can impact the other. And so there's all sorts of physical changes that can help when you're that can occur when you're under a lot of stress. When I talk about stress in this presentation, I'm specifically talking more about chronic stress. And so we all experience different levels of short-term or acute stress. This could be a work deadline and you have to get something finished, but it has an end date. Long-term stress doesn't necessarily have an end date. So it's something that's either repeated on a regular basis or doesn't improve with time. And so this can occur when things are piling up, multiple smaller stressors over time, or it can be something large like a physical health change, NTM, a diagnosis, that doesn't necessarily go away with time. And so often within about 1 to 3 months, we can experience exhaustion, a state of exhaustion. This can really, it can have a big impact on our bodies. So always ask yourself, is your stress cup overflowing? Like, do you have a lot in your life right now that's causing you to feel stress? Because when we can't change certain situations, really all we can change is ourselves. And so how we react to these situations is sometimes the best we can do. When we talk about building a skill set, I always like to let people know you already have a skill set for dealing with stress. As functioning adults, you all know how to manage stress to some degree. And so what works well for you? Because those are going to be the skills that you want to lean on in times of stress. You want to try to choose things that are active rather than passive. And really what I mean by that is something that's addressing the issue and being more proactive with it. Passive strategies often take the form of avoidance, substance use, skipping medical treatments, things like that. Passive strategies might help you feel better in the short term, but they're going to hurt in the long run. So anytime you can address something head on, that's going to be better for you. So when we talk about different skill sets, I kind of broke it down into 3 different sections. And so the first section is thoughts that I want to talk about, because how we think about things really impacts how we feel and also how we behave and react. So whenever we're faced with a situation, something happens, we all have thoughts that come into our head, some sort of interpretation of the situation or how we perceive the situation to be occurring. How I perceive something is going to be different than how any of you perceive something. And that's going to impact how you feel about the situation, how I feel about the situation, and then also how we react. It doesn't look as neat as this breakdown all the time. You know, we're not always aware that, okay, I'm having a thought now I'm having an emotion. It's a very quick process that happens, but breaking it down and recognizing it can also help us manage our stress. So we tend to latch on to the thoughts that come to mind first or most often. So if you're a pessimist by nature, or you tend to be hard on yourself, those thoughts are probably going to come easily in situations, and you're going to latch onto them. Not necessarily because they're more accurate, but because that's what you're used to doing. Over time, I think everyone can agree how latching on to maybe these negative, inaccurate, or unhelpful thoughts can create some issues, especially when we think about how we feel and how we react to a situation. So, I mean, just as an example here, the situation that I'll give you is, you know, let's say that a friend is walking down the street and you pass them. How you interpret it is going to impact how you feel. So if that friend doesn't say hi to you, you know, some of us might feel, okay, I've done something wrong. They're mad at me. What happened? Some people might think, oh, they didn't see me. That's why they didn't say hi. And you can see how that's going to result in two different ways of feeling and also two different ways of reacting. I didn't include that, but you know, if you're interpreting it as something that you've done wrong, you might reach out to the friend, you might worry, you might panic. If you think it's just kind of a one-off and the friend didn't see you, you might be able to move past that more quickly. And so the goal of this type of thinking isn't necessarily to see things one way or the other. I think when I work with patients, a lot of times it can feel like I'm trying to convince people to gaslight themselves into thinking positively, which is a whole other issue, because there is such a thing as toxic positivity. You don't need to think everything is rainbows and sunshine, but you need to be able to see both possibilities. So in this example with the glasses here, you know, whether the glass is half full or half empty, it's not so much about which one is true, but it's about the ability to be able to see both. And so we call that cognitive flexibility, and it's related to a whole host of positive outcomes in different diseases and different disease management, as well as depression, anxiety, and stress. And so again, it's really about the and, not the or. So things not being right or wrong. It's being able to see, yeah, something can be right and it can be wrong. So it's a whole different style of thinking if this isn't something you're used to doing. Another thing with thoughts that I like here, it's a specific skill called unhooking from thoughts. And so with this, what you do is you essentially try to view your thoughts as just that, a thought. So if you're having, you know, the thought of I'm useless, if you hook onto that and you believe that to be true, that's going to have a very different impact than if you say, I'm noticing I'm having a thought that I'm useless. You can see how those two things feel quite different. And so as you're adjusting to a new type of, you know, situation, going easy on yourself and recognizing that these thoughts are just that, they're just thoughts. All right. So I'm going to keep on moving here, and I'm going to talk a little bit about different types of behaviors that might help with coping through stressful situations. One thing that I want to point out is breathing exercises. So when I'm a pretty scientific person, and so when I got involved in this type of research, it was maybe a little hippie for me, but I've been convinced over time how important proper breathing is, not only for, you know, a host of physical issues, but also for how you feel, how you react to stress. And there is science behind this. So sometime when you're laying down in bed, even if you think I'm crazy, I want you to try this. So put a hand on your chest and then put a hand on your diaphragm. So your diaphragm is a muscle, a dome-shaped muscle, right below your ribs. And so you can practice moving those two hands. And so I want you to notice what it feels like when you breathe through your chest. So oftentimes it's a tighter, more restricted type of breath. Then when you breathe through your diaphragm, it allows your chest to fully expand. And that diaphragmatic breathing is really important to activating what we call the parasympathetic nervous system, which is a fancy way of saying the off switch for stress. So it helps deactivate that stress response. So this is really quite powerful. If in a stressful situation, you can utilize this diaphragm, it's going to help. But it's like with everything, it takes practice. You don't want to go into a stressful situation and be doing this for the first time. So definitely try this out sometime. Another skill that I really like is called the 5-4-3-2-1 technique. It has a bunch of different names, but it's essentially a grounding exercise. So I don't know if anyone's ever heard of this, but this is really great in situations where the stress is so strong that sometimes people can dissociate. So what that means is you almost kind of disconnect from your surroundings. Has anyone ever experienced that, where they're under so much stress or they're feeling so anxious or worried that you kind of lose track of your surroundings? Yeah. So this is a really great response to that. So what you do is you try to point out things that you can actually physically detect with your senses. So 5 things that you can see. It can be as simple as, you know, the black of the microphone, the brown of this podium. It doesn't have to be anything extreme. 4 things that you can feel, even if, you know, if I asked you, can you notice the cushions on the seats that you're sitting on? Can you feel your glasses, those of you that are wearing glasses behind your ears? So picking up on those sensations that might already be present, but you're not paying attention to them. 3 things that you can hear, 2 things that you can smell, and if you can taste anything, 1 thing you can taste. But essentially what this is doing is dropping an anchor into the present moment and reconnecting you. It's getting you out of your thoughts, getting you out of the feelings, and back into the moment. Self-care. Okay, so self-care is a buzzy word. I think it's a popular word right now. You see it all over social media and different news articles. Self-care, at the very base of it, what I like to think of self-care as is intentional practice of something that you could enjoy. And the reason I emphasize could is because when you're stressed, when you're anxious, when you're depressed, when you're dealing with a lot, it might feel like you can't enjoy anything that you used to enjoy. So the point isn't to actually enjoy it. The point is that you could enjoy it. And it doesn't have to be anything extreme. So, you know, I think if you look at self-care lists online or something, they might say, you know, take a vacation, and sure, that's great, but how realistic is that every day to take a vacation? So, you know, what's something you can do in 5 minutes when you're driving or when you're sitting down at the end of the day before you go to bed? Something that you could enjoy, something that is just for you. You should be doing something just for you every single day, even if it's small. All right, my favorite. We're going to talk a little bit about sleep. Does anyone struggle with sleep? Wonderful. Okay. Well, no, sorry, that's bad. Not wonderful, but I am here to help, hopefully. So when we talk about sleep, there's a couple of different aspects that are associated with good sleep. And so insomnia by definition is difficulty falling asleep or staying asleep, or dissatisfaction with your sleep quality. But good sleep health is a lot more than that. So people can not have insomnia or not necessarily struggle with those aspects, but maybe struggle with something else related to their sleep. So really you should feel a sense of satisfaction with the quality of your sleep. And this means feeling rested throughout your day. However, a caveat to that is when you're dealing with acute physical illness or some sort of infection, you might experience fatigue that has nothing to do with your sleep. However, you know, ideally you're feeling rested throughout the day. You don't need to feel rested the second you wake up. So when I work with patients, a lot of times they're concerned because they wake up and it takes them a little bit to come to. And that's okay. That doesn't mean that your sleep quality was necessarily poor. Sleep regularity, really you want to be getting in and out of bed around the same time every day. The timing of your sleep. So when we talk about circadian rhythm and timing of sleep, there's a lot of research there that shows, you know, this can be a major factor in decreased sleep quality. Sleep continuity, not spending more than 30 minutes awake during this sleep period. So that's either at the beginning of the night or in the middle of the night. You want to be sleeping about 6 to 9 hours, ideally. Some people need a little bit less, like 5 to 6. Some people need more, like 9 or 10. It is not a one size fits all. That 8-hour rule is a myth. So, you know, our sleep needs do change as we age as well. And then you want to be able to stay relatively alert throughout the day. And so if you're having issues in 1 or maybe 2, 3, or all of these categories, there might be some room to improve your sleep health. So one of the things that I would recommend if you are someone that's struggling with insomnia or sleep is to maybe consider downloading this app. It's called Insomnia Coach. It's a free app. It's developed by the VA in Stanford. And it's actually a self-help approach to the types of treatment that I do in our sleep clinic. However, it's a good introduction, at least, into these types of skills. But one of the skills that I think can be most beneficial for people is to set a bedtime and a wake time. And you want to set it to match what you're actually sleeping, not necessarily what you want to be sleeping. And so what I mean by that is a lot of times people set their time in bed based on what they're hoping to sleep. So if they want to sleep 8 hours, they're going to give themselves 9, 10 hours in bed, and hopefully they'll sleep for part of that. And they do, but it fragments your sleep. So if you're only sleeping, let's say on average, 6 hours, you should really only be scheduling about 6.5, maybe 7 hours for sleep. That should be your sleep window. So for someone that's, let's say, goes to bed at midnight and wakes up at 8, if they're only sleeping 6 of those hours, they're actually waking up closer to 6 in the morning. That 8 o'clock wake time is way too late. So a lot of times with patients, I recommend going to bed a little bit later when you're more sleepy. It's going to help you fall asleep faster. Or if you happen to be waking up earlier than you want, go with that wake time for a little bit. You can always expand your window in bed again, but first you have to trim out the fat, pare it down, and get closer to what you're actually sleeping. One other thing I wanted to mention is a dose of sunlight in the morning is really important to help with your circadian rhythm, which is the internal clock that regulates the timing of our sleep and wakefulness. And so you don't have to go outside and stand in the sun and stare at it or anything like that, but sit in a brighter area of your house if you can for about 30 minutes, open the blinds. The worst thing you can do is sit in the pitch black with your blackout curtains drawn first thing in the morning. That's going to lead to a lot of disruption. So getting some sunlight for about 30 minutes in the morning is going to help your body know when to be awake and also when to be asleep. Related to that, spending too much time in bed can also make sleep more challenging. So has anyone heard of Pavlov or Pavlov's dog before? Classical conditioning, maybe back in Psych 101 or something like that. So essentially, we can condition ourselves to do all sorts of things we didn't mean to condition ourselves to do. So just like with this very classic example of the dog, when the dog was presented food, the dog would drool. When you ring a bell, the dog wouldn't do anything. Over time, if you paired the two, the dog would salivate just to the sound of the bell. So now the dog had been conditioned to associate that bell with food. Same thing can happen with the bed. So if you're stressed, anxious, awake, alert for any reason, it's going to be pretty challenging to sleep. You're going to be pretty wide awake. If you pair that with the bed, you're also going to be awake. Over time, you don't even need those negative emotions or responses. You just get in bed and you're wide awake. And so this can be a conditioned response for people that tell me they're exhausted, they're so tired, they move to the bed and it's like, bing, the lights turn on. That's a conditioned response. And so if that ever has happened to you, where you're really struggling either to fall asleep in your bed or when you wake up, you struggle to fall back to sleep, it's probably a conditioned response. The good news is you can untrain yourself to do all of the bad habits that you've taught yourself to do. The bad news is it's also not too fun to do this. So I know all these strategies. Do I always follow them? No. My husband's always like, should you be in bed awake right now? And I'm like, shut up. You don't know what you're talking about. But in theory, when you are awake in the middle of the night or in the beginning of the night, you want to get out of bed. You don't want to lay in bed trying to force sleep. You don't want to lay in bed reading. You don't want to lay in bed watching TV. You really want to reserve the bed for sleep. Sleep and sex, those are the two things you can do in bed. Everything else should be outside of the bed. So if you're awake for longer than 15 to 20 minutes, leave the bed. I think the common misconception is that that's somehow going to help you get more sleep that night. A lot of my patients are like, I tried that and I was awake for 2 hours in the middle of the night. That's a possibility. It might not help you that night, but what it's going to help with is retrain you in the long run. So to retrain that association between the bed and sleep. So you might have to repeat this. You might have to do, something that you don't want to do in the middle of the night, but it will help your sleep in the long run. And the last piece I'll put in about sleep, and then I promise I'll move on to the rest, is to think about napping. For people that nap and they have no issues with sleep at night, that's fine. But if your sleep is disrupted at night and that's a concern for you, you probably need to look at the daytime sleeping. People with NTM and on certain medications, they might need more sleep and they might be more sleepy. So again, if you can nap during the day and you can sleep a full night, that's fine. This is really for people where it's disrupting their nighttime sleep. You can nap. You just want to do it in a way that's smart, that's not going to affect your sleep at night. 30 minutes, maybe an hour for a rest period is fine. You want it to be 7 to 9 hours after your wake time. So that's the part that sometimes people miss. They'll wake up and then go back to bed, late morning or to take a nap. That's too early. That messes with your circadian rhythm. You want it to be a good 7 to 9 hours after you wake up, but not too close to bedtime. That's another issue. All right, so let's see how I'm doing on time. Okay, so I'm gonna get through this last part pretty quickly, and then if anyone has any questions. When it comes to social support, I just wanna mention that social support is really important. There's a lot of research, there's a whole field of research on the impact of social support and coping. And research really supports quality over quantity. So you don't need 50 people in your corner, just one good source of social support is gonna make a difference. Leaning on that social support, I think, is something else to consider because a lot of times we're not willing to ask for help or we're not willing to receive it. So someone might say, I know you're stressed. Can I bring you dinner? And oh, no, don't worry about it. How many people do that? It's hard to rely on other people, but that's going to make a difference in how you feel and how you cope in the long run. So not only, are you asking for support, but are you allowing it? And then professional support, because sometimes, stress, like we mentioned, is a regular part of this, but sometimes it can become overwhelming. Sleep issues can be too much, stress can be too much, anxiety, depression. There is some suffering that comes with just day-to-day life, but there's no need to excessively suffer. There are ways to decrease that suffering. Depression, where this can come into play is depression, sadness, feeling down is completely normal. It's a normal emotion. What I always tell people is just consider how much it's impacting you. Are you feeling sad most of the day, almost every day? Has it lasted for at least, a couple of weeks? And is it getting in the way of something? Is it, keeping you at home instead of seeing friends? Is it impacting, your ability to get through activities or work? If the answer is yes to any of those, it's probably time to consider professional help. And that doesn't mean you have to go check yourself into, some sort of treatment facility. This can just be as simple as talking to your primary care doctor. Primary care is actually a really good place to start when you're considering maybe a medication for depression or anxiety. I think a lot of times people assume they need to go see a psychiatrist, and it's really hard to get in with psychiatry in many places. So primary care can be a good place to at least start having that discussion. Same thing with anxiety. It's very normal to feel worried, to feel anxious in these situations. However, is it becoming overwhelming and is it influencing multiple areas of your life? Is it hard to control the worry? Can you not turn your head off, your brain off? Are you thinking and worrying about every little aspect? This is, again, when it might be time to consider something in addition to the coping skills that I talked about today. And then for research in terms of treating depression and anxiety, what research shows is medications, psychotherapy, so counseling, both are about equally effective. The most effective approach is when you combine the two, when you do medication and therapy together, we see the most robust results. However, for very severe depression and anxiety, medication is often crucial. You really can't leave that part out. But again, considering both together is sometimes the most effective. I included some resources in here on how to find a therapist in your area, because I know probably a lot of you aren't from Colorado or Denver. And so there's some good resources for how to find a therapist if that's something that you want to consider. I won't go through it, but it's available for you in these slides. Yeah, so I think just in summary, stress is a very normal part of this. There are coping skills available to you, whether, it's addressing your sleep, looking at how you're breathing, looking at the way you're thinking about certain situations, leaning on social support. These are all great ways to help cope with stress. And then if you need something more, there is professional support available. So, all right, well, thank you for your time. Any questions?